Welcome everyone to our presentation on occupational health and safety. I am Gwen Nanette Bagunas with the student ID number 159068220, and together with my groupmates, Ms. Mary Joy Lau, Ms. May Arian Duque, and Mr. Jose Marie Villanueva, will cover various topics related to OHS in the upcoming session. After the introduction and presentation of objectives, we'll explore specifically on employer and employee obligations, impact of COVID-19 on health and safety, consequences of positive and negative stress, and exploring and addressing COVID-19 issues, followed by the summary, conclusion, and references. At the end of the presentation, the audience will be able to understand the importance of occupational health and safety, analyze the differences and similarities between employer and employee obligations concerning H&S, understand the various ways in which the COVID-19 pandemic has affected the workplace H&S, define negative and positive stress and their effects on individual health and well-being, recognize common COVID-19 related issues and challenges faced in the workplace, and finally, exploring effective strategies for addressing COVID-19 issues. What is occupational health and safety? The objective of occupational health and safety legislation is to safeguard workers against workplace hazards by delineating the rights and responsibilities of employees, supervisors, and workers. This legal framework holds both parties accountable for ensuring workplace health and safety. The importance of occupational health and safety spans several critical areas, impacting not just the individual employees, but also the overall functioning and success of businesses and the wider economy. These include worker protection, legal compliance, economic impact, employee morale and retention, productivity and efficiency, and corporate reputation. These factors highlight the significant importance of prioritizing occupational health and safety in Canadian workplaces. HRM is responsible for managing the workforce to ensure their health, safety, and welfare while at work. Therefore, implementing and maintaining effective occupational health and safety practices falls under the purview of HRM. Moving forward, according to Brutus and Baronian, employer and employee obligations have similarities and differences. Employee obligations include providing a safe workplace, adherence and regulation, taking all sensible measures to safeguard the health and safety. Specific duties are informing employees about H&S requirements, investigating accidents and keeping records, compiling annual summary of work injuries and illnesses, reporting accidents, injuries, and diseases, ensuring supervisors are familiar with the work and hazard, and providing health and safety training. Whereas, employee obligations include abiding by laws and regulations, reporting hazards and impaired devices, actively participating in health and safety initiatives, gathering and obtaining information regarding health and safety protocols, and declining hazardous tasks with exemptions. In summary, both parties play crucial roles in ensuring occupational health and safety. While employers are responsible for providing a safe working environment and implementing safety measures, employees are responsible for following safety protocols, reporting hazards, and actively participating in maintaining a safe workplace.
I'm Mary Joy Lau, student number 127867232. The COVID-19 pandemic has significantly reshaped workplace health and safety protocols, primarily focusing on preventing the spread of the virus. This includes the use of personal protective equipment, such as masks, gloves, face shields, and gowns, has become essential in many workplaces to protect employees from exposure to the virus. Employers are responsible for providing appropriate PPE and ensuring its correct usage. Second is physical distancing measures. Institutions must implement protective measures such as rearranging workspaces, staggering shifts, and limiting the number of employees in common areas to maintain physical distance and reduce the risk of transmission. Hygiene practices, promoting regular hand washing, sanitizing surfaces, and providing hand sanitizers throughout the workplace to reduce the spread of the virus. Remote work arrangements, encouraging or mandating remote work for employees whose tasks allow for it. It reduces the number of employees physically present in the workplace and minimizes the risk of exposure. Health screening protocols, implementing temperature checks, symptom screenings, and COVID-19 testing where necessary to identify potential infected individuals and prevent them from entering the workplace. Stress is a natural physiological and psychological response to a perceived threat, challenge, or change in one's environment. While stress is a normal part of life and can sometimes be beneficial in motivating individuals to perform better or respond to emergencies, prolonged or excessive stress can have negative effects on physical, mental, and emotional well-being. Among the positive consequences are the motivation. Moderate stress levels can serve as a driving force, pushing individuals to perform better and achieve goals. Another is adaptability. Stressful situations can motivate individuals to acquire and develop new skills or coping mechanisms, ultimately strengthening their ability to adapt to future challenges. The negative consequences, there's the physical health impact. Experiencing stress for an extended period of time can result in a range of physical health problems, including headaches, muscle tension, fatigue, and a weakened immune system. Second is mental health problems. Chronic stress is linked to mental health disorders such as anxiety, depression, and burnout, affecting overall well-being and productivity. Third is decreased work performance. Excessive stress can negatively affect the nurse's ability to think, make good decisions, and perform well at work, leading to errors, absenteeism, and reduced productivity. Fourth is poor interpersonal relationship. Stress can strain relationships among colleagues and supervisors, leading to conflicts, communication breakdowns, and decreased overall team cohesion. The CNA recognizes that healthcare workers face unique challenges and stresses, and providing them with accessibility and specialized mental health support can help mitigate adverse effects and improve their overall well-being. It is important for institutions to implement strategies aimed at reducing the harmful effects of stress. The measures includes promoting work-life balance, encouraging employees to maintain a healthy work-life balance through flexible work arrangements, time off, benefits, and wellness programs, providing support services, offering access to counseling, employee assistance programs, and resources for stress management and mental health support, encouraging communication and feedback, fostering open communication channels where employees feel comfortable expressing concerns, providing feedback, and seeking assistance when needed. Providing training and education, training programs that teach participants how to manage stress effectively, develop resilience, and recognize the symptoms of stress in themselves and others.
I'm Marian Duque, student number 159063221. So I'm going to talk about exploring and addressing issues brought about by COVID-19. During the COVID-19 pandemic, as we are all unprepared, several occupational health and safety issues have become particularly prevalent across various industries. Some of the common ones include inadequate personal protective equipment. Without adequate PPE, workers are at a higher risk of contracting and spreading the virus, endangering their health and safety. Solution: established a comprehensive inventory management system to track PPE supplies, procured an adequate supply based on risk assessments and guidance, provided training on proper use and enforced usage policies. Second is lack of proper training. Proper training on COVID-19 prevention measures is crucial to ensure that employees understand how to protect themselves and others. Solution: developed and delivered training modules covering COVID-19 prevention measures, including hand hygiene and respiratory etiquette, utilize various methods and ensured regular updates. Third is workplace hygiene. Maintaining high standards of cleanliness and hygiene in the workplace is essential to prevent the spread of COVID-19. Solution: established and enhanced cleaning protocols, providing access to hygiene facilities and products, assigning cleaning responsibilities, and educating employees on proper practices. Next is physical distancing. Physical distancing is a key measure to reduce the transmission of COVID-19 in workplaces. Solution: conducted workplace assessments, implementing measures like rearranging workspaces, providing signages, and encouraging virtual meetings and telecommuting. Fifth is mental health concerns. The COVID-19 pandemic has taken a toll on mental health, with many workers experiencing increased stress, anxiety, and burnout. Solution: offered resources and support for managing stress, providing access to mental health services, fostering open communication, and promoting work-life balance. Sixth, communication and information. Clear and timely communication of COVID-19 related policies, procedures, and updates is essential to keep employees informed and engaged. Solution: established clear communication channels, utilizing multiple methods, ensuring accuracy and accessibility, and encouraging feedback. Seventh, workplace ventilation. Proper ventilation is critical to reduce the concentration of airborne particles, including the virus that causes COVID-19 in indoor spaces. Solution: assessed and improved ventilation systems, increasing fresh air circulation, considering air purifiers, and maintaining systems regularly. Next, workplace screening. Screening measures such as temperature checks and symptom questionnaires are important for identifying potentially infected individuals and preventing them from entering the workplace. Solution: implemented regular inspections and audits, encourage reporting, address non-compliance promptly, and adopted protocols based on feedback and guidelines. Next is high-risk workers. Certain individuals, such as older adults and those with underlying health conditions, are at higher risk of severe illness from COVID-19. Solution: identified high-risk employees, provided accommodations and education on precautions, and ensured support. Next is travel and commuting. Business travel and commuting present opportunities for virus transmission, especially in crowded or confined spaces. Without proper safety measures in place, such as remote work options and alternative transportation arrangements, employees may be at risk of contracting and spreading the virus during travel. Solution: develop policies for safe travel and commuting, promoting virtual meetings and remote work, providing guidance on safe practices, and considering alternative transportation. Lastly, quarantine and isolation protocols. Establishing clear protocols for identifying and isolating employees who have been exposed to COVID-19 is crucial to prevent outbreaks in the workplace. Without proper protocols in place, infected individuals may continue to come to work, leading to further spread of the virus among coworkers. Solution: established clear protocols for reporting symptoms and exposures, providing guidance and support during quarantine, and communicating return to work expectations.
Jose Marie Villanueva, student ID 125154237. As we wrap up our presentation on occupational health and safety, let's take a moment to reflect on the crucial points we've discussed to enhance understanding and promote effective practices in Canadian workplaces. Importance of occupational health and safety. Occupational health and safety legislation aims to safeguard workers against workplace hazards by defining the rights and responsibilities of employers, supervisors, and workers. Human resource management, HRM, plays a pivotal role in managing the workforce's health, safety, and welfare, emphasizing the importance of effective OHS practices. Employer and employee obligations. Both employers and employees have crucial roles in ensuring OHS. Employers provide a safe working environment and implement safety measures, while employees follow safety protocols, report hazards, and actively participate in maintaining workplace safety. Impact of COVID-19 on health and safety. The COVID-19 pandemic significantly reshaped workplace health and safety protocols, focusing on preventing virus transmission and increased mental health awareness. Measures include providing PPE, implementing physical distancing, promoting hygiene practices, facilitating remote work, and conducting health screenings. Consequences of positive and negative stress. Stress, both positive and negative, impacts individual health and well-being. While moderate stress can motivate and enhance adaptability, prolonged stress can lead to physical health problems, mental health disorders, decreased work performance, and strained interpersonal relationships. Exploring and addressing COVID-19 issues. The pandemic brought various OHS challenges, including inadequate PPE, lack of proper training, hygiene concerns, mental health issues, communication gaps, and high-risk worker management. Effective strategies involve inventory management for PPE, comprehensive training on COVID-19 prevention, maintaining workplace hygiene, ensuring physical distancing, providing mental health support, clear communication, and establishing quarantine and isolation protocols. We extend our heartfelt thanks to everyone for joining us in this presentation. Let's unite our efforts in creating a safe and supportive environment for all frontline workers. Together, we can make a positive impact and show our unwavering support for those who dedicate themselves to the service of others. Thank you for being a part of this important group presentation on occupational health and safety.